can probably tell straight away, I'm not from the US, I'm from the UK. And I'm really honoured to be part of this discussion. Thank you so much for having me. And not a little humbled really by hearing all of the previous speakers. Thank you so much. So I'm Fiona. I'm going to shine a bit of a light on perinatal mental health and the UK context, which are some things that I have some things to contribute to in this space. And I really want to highlight I'm going to be talking about sort of maternal mental health and really highlight some things which have made a difference in the UK context. So I'm sure many of you already know that there are very many mental health difficulties that are very common in the perinatal period, so pregnancy up to 1 year, and should be longer really. So these are UK English statistics, in fact, so multiplied many times in your context, but actually show that actually about 20% of women suffer from some kind of difficulty at this time, and that's in high income countries with an even higher prevalence in low and middle income countries. And there's some longitudinal data that suggests that prevalence is increasing by generations. And actually, this is a very recent US study showing rates of depression in girls rising and rates of difficulties in young people rising much more highly than in the older generation. And in young girls, even higher than boys. So going from 11% to 23%, so 3 times the rise in boys. And connected with this, it seems that young mums are experiencing even higher rates. So in our London context, we did a study of young mums, and about 2/3 of those had a diagnosable problem, and more critical analysis of that shortly. But lots of that was explained by anxiety and particularly experiences of trauma. And so these problems, of course, by definition, impairing for women. But if that wasn't bad enough in itself, we're also talking about high levels of exposure of children to a caring environment that's impacted by these problems. And again, it seems to be rising. So in this UK context, from 22 to 25% over a 10-year period of children exposed to maternal illness. And you can see from the graph on the right, that first exposure is very weighted to this perinatal period. It's such a difficult time. And we know that the parental mental health disorders are associated with increased risks of all sorts of outcomes related to children. Just to take the example of depression here. And this review highlights a whole range of areas that children might be affected. And of course, some of the mechanisms: family conflict, poorer functioning for parents in terms of their availability and sensitivity, fewer safe parenting practices, such as using car seats and uptake of vaccinations. And these effects tend to persist across childhood. So there really are kind of long-standing ramifications and public health implications for both parent and child. But of course, these things are not inevitable, and they're not evenly spread, as well as all of our previous speakers have highlighted very clearly and eloquently. But there are modifiable factors, so social adversity, the presence of other adults, having a positive relationship with children, the couple relationship, and of course, how severe and persistent the issue is for the mother. And that's, of course, the goal of some treatment. So there are some really good examples showing that if we can treat people, if we can treat women effectively, then we can reduce some of that impact on children. And this is the results of a big American study shown here. So we do have treatments that can work, but of course there are issues at literally every point on the care pathway: identifying people, getting access to services, even when treatment's given adequately, and treatment response. So again, this is a US study, but there's a very high drop-off rate, really, even from the, I think, inadequate, we could say, number of people who are identified. So in the UK context, We really didn't have great services before 2014. And although we knew about this impact on mothers, birthing people and children, certainly in the ivory towers of research institutions, our clinical services were not mirroring this and providing that needed help. And in fact, were kind of non-existent in many areas. So what we did have was a lot of expert by experience led charities in perinatal mental health. You can see that little logo on the bottom right there. About 100 of these, more than, got together and formed something called the Maternal Mental Health Alliance. So it was just an umbrella organization for all these incredible third sector organizations that worked in psychosis, depression, and all the different areas. And they commissioned a systematic review and an economic report with one of the universities here that collated all that evidence. And as you can see from the infographic here, there were some really arresting findings. That for us, the long-term cost to society was about £8.1 billion for each year of untreated maternal mental illness in the UK. So that meant for us at the time about £10,000 for every single birth in the country. And most of those costs related to ongoing costs for the child. So really, I think what actually persuaded the politicians was that the cost of not treating were about 5 times the costs of actually putting some money in treating these difficulties. And at this point, only about half of women had any access at all to services. So the Maternal Mental Health Alliance embarked on this campaign. They're called Turn the Map Green. And the government put about £365 million to the development of new services. So we have outpatient community mental health services, we have mother and baby units. And now, just most recently, we have specialised services related to maternal loss. So you can see from these graphics that actually it's had a huge effect, and that really was from the work of this Maternal Mental Health Alliance. And of course, one of the key things is not just turning the map green, but keeping it green. So again, their campaign is ongoing, and we have in our NHS, goodness knows what's happening now, but we have aspirations over the next 5 years, and perinatal mental health is really embedded in what the government say is the long-term plan. So it really has, I think, put down roots in terms of the importance in the UK context, which is amazing. So these changes are really important, but of course they're still not enough. And if we're centering mothers in this agenda, who should we be looking for? And this one really influential review looked at predictors of anxiety and depression, which make up a large percentage of the problems. And I haven't documented every single one from the review, but you'll see that many of these are, of course, to do with wider social difficulties and inequalities. So this review commented on a lack of evidence of paternal and partner mental health, but there is, of course, increasing evidence that this not only impacts children, but impacts maternal mental health as well, and health outcomes. We know that domestic violence is hugely prevalent and often starts during pregnancy, and of course is associated with unwanted pregnancies and can cause pregnancy loss too. So these, where I've put these characteristics of the pregnancy, they don't happen in a vacuum. And again, all of the other speakers have touched on this. And in the UK, we are, of course, no different in terms of having huge health inequalities and disparities according to race. We have a system which collects all the evidence about each maternal death to try and really help understanding and prevention. And in one of our most recent reports, we found that ethnic disparities in terms of childbirth complications and maternal deaths were really no other explanation but due to the care received. And that was mirrored in another population study and so on. So this really, of course, has to be at the forefront in our thinking of how we develop and deliver services. And again, that really is coming through. We can't get any grant funding without explicit recognition of these inequalities and what we are actually doing within every single grant to address these and acknowledge these. So we're really lucky to have a wider coverage of services, but still a long way to go. And the Maternal Mental Health Alliance, the latest campaign is to make all care count. So it's to keep up this development of services, support sustainable, high quality working professionals, and encourage every single person who has contact with women and birthing people to be aware and to make a difference in terms of access to services, in terms of all other forms of support. So interactions at every level are important. So just to summarize, the perinatal period is a time of increased risk for these types of difficulties, but is a time of increased opportunity. People are in contact with services and often hugely motivated to engage in any sort of intervention. We know that paternal and partner mental health is, of course, really important, but interacts with maternal mental health. So it does just affect at least 3 people in every unit where those people are around. And it is, as I say, a time for increased opportunity to intervene. So you really do get a lot of bang for your buck in terms of these interactions and interventions. And it goes without saying that therefore improved maternal mental health outcomes mean improved outcomes for everybody. And that's all I've got to say on that one. Thank you.